Hello, I am Dr. DeAndre. Today, I will talk about how stress can increase cancer risk. This is a serious and often misunderstood topic. Many people think stress is only a mental issue, but scientific evidence shows that chronic stress can affect your body at a cellular level. Research indicates that long-term stress may weaken your immune system, increase inflammation, and create an environment where abnormal cells can grow more easily. In today's video, I will explain what science tells us about the connection between stress and cancer, how it affects your body, and what practical steps you can take to reduce your risk. Let's explore this important topic in a clear and evidence-based way. Stress is the body's natural response to any demand or threat. When you face a stressful situation, your body activates the fight or flight response. This leads to the release of hormones, such as cortisol and adrenaline. In short-term situations, this response is helpful. It increases alertness, heart rate, and energy levels. However, when stress becomes chronic, meaning it lasts for weeks, months, or even years, it starts to harm the body. Chronic stress keeps cortisol levels elevated. High cortisol over time can disrupt many important biological systems. It can weaken the immune system, making it harder for the body to detect and destroy abnormal cells. It can also increase blood sugar levels, raise blood pressure, and disturb sleep patterns. These effects combine to create a less healthy internal environment. Scientific studies have shown that chronic stress can lead to persistent inflammation in the body. Inflammation is a natural process used to fight infections, but when it becomes long-term, it can damage healthy cells and DNA. This damage may increase the risk of mutations, which are changes in cells that can potentially lead to cancer. Another important effect of stress is on lifestyle behaviors. People under stress are more likely to smoke, consume unhealthy foods, avoid physical activity, and experience poor sleep. All of these are known risk factors for cancer. Therefore, stress does not act alone. It contributes indirectly by influencing unhealthy habits. In summary, stress is not just a mental issue. It has real, measurable physical effects on the body. When it becomes chronic, it can weaken defenses, increase inflammation, and contribute to conditions that may raise cancer risk over time. It is important to understand that stress itself does not directly cause cancer in the same way as smoking or radiation. However, it plays a significant role in creating conditions that may support cancer development. One of the key mechanisms is immune suppression. The immune system is responsible for identifying and destroying abnormal or damaged cells. Chronic stress reduces the efficiency of this system, allowing potentially harmful cells to survive longer. Another mechanism involves inflammation. Long-term stress increases inflammatory markers in the body. Chronic inflammation can damage DNA and promote cell growth in an uncontrolled way. This environment may increase the likelihood of tumor formation. Studies have found links between chronic inflammation and cancers such as colorectal, breast, and prostate cancer. Stress hormones like cortisol also affect how cells grow and repair themselves. In some laboratory studies, elevated stress hormones have been shown to influence tumor growth and spread, particularly by affecting blood vessel formation, a process known as angiogenesis. Tumors need blood supply to grow, and stress may support this process indirectly. In addition, stress impacts hormonal balance. For example, chronic stress can influence estrogen levels, which is relevant in hormone-related cancers such as breast cancer. It can also disrupt insulin regulation, increasing the risk of metabolic conditions that are linked with certain cancers. Behavioral factors also play a major role. Individuals experiencing chronic stress are more likely to engage in high-risk behaviors. These include smoking, excessive alcohol consumption, poor diet, and lack of exercise. Each of these factors independently increases cancer risk, and stress amplifies their impact. In conclusion, stress contributes to cancer risk through multiple pathways. It weakens immune defense, increases inflammation, alters hormone levels, and promotes unhealthy behaviors. While it may not be a direct cause, it is a significant risk factor that should not be ignored. Scientific research on stress and cancer is ongoing, but several studies provide important insights. Large population studies have shown that individuals exposed to long-term psychological stress may have a slightly higher risk of developing certain cancers. For example, studies on caregivers, individuals experiencing chronic anxiety, and those under prolonged work stress have demonstrated measurable biological changes. Research published in medical journals indicates that chronic stress is associated with increased levels of inflammatory markers such as C-reactive protein and interleukin-6. These markers are linked with cancer progression and poorer outcomes in some patients. Additionally, studies have shown that stress can reduce the activity of natural killer cells, which are essential for destroying cancerous cells in the body. Animal studies have also provided valuable data. In controlled environments, animals exposed to chronic stress showed faster tumor growth compared to non-stressed groups. These findings suggest a biological link, although human studies are more complex due to multiple lifestyle and environmental factors. Clinical observations in cancer patients have also highlighted the role of stress. Patients with high stress levels often show weaker treatment responses and slower recovery. Stress management interventions, such as counseling and relaxation techniques, have been associated with improved quality of life and, in some cases, better treatment outcomes. It is important to note that not all studies show a direct cause and effect relationship. Cancer is a multifactorial disease, meaning it develops due to a combination of genetic, environmental, and lifestyle factors. Stress is one part of this complex picture. Overall, scientific evidence supports the idea that chronic stress affects biological systems in ways that may increase cancer risk or progression. While more research is needed, the current data strongly suggests that managing stress is an important part of maintaining overall health. Managing stress is essential for reducing potential health risks, including those related to cancer. One of the most effective methods is regular physical activity. Exercise helps lower cortisol levels, improve mood, and strengthen the immune system. Even moderate activities such as walking for 30 minutes a day can have significant benefits. Sleep is another critical factor. Poor sleep increases stress hormones and weakens immune function. Adults should aim for 7 to 9 hours of quality sleep each night. Maintaining a consistent sleep schedule and reducing screen time before bed can improve sleep quality. Nutrition also plays a key role. A balanced diet rich in fruits, vegetables, whole grains, and healthy fats supports the body's ability to manage stress. Antioxidants found in these foods help reduce inflammation and protect cells from damage. Mindfulness and relaxation techniques are scientifically proven to reduce stress. Practices such as meditation, deep breathing, and yoga can lower heart rate and cortisol levels. Even a few minutes daily can make a difference. Social support is equally important. Staying connected with family and friends helps reduce feelings of isolation and stress. Talking about concerns and seeking emotional support can improve mental well-being. Limiting harmful habits is crucial. Avoid smoking, reduce alcohol intake, and minimize consumption of processed foods. These behaviors not only reduce stress but also directly lower cancer risk. In some cases, professional help may be necessary. If stress becomes overwhelming, consulting a healthcare provider or mental health professional is recommended. Therapy and counseling can provide effective coping strategies. In summary, stress management is a practical and achievable goal. By improving lifestyle habits, maintaining strong social connections, and seeking support when needed, you can significantly reduce the negative impact of stress on your body. In conclusion, stress is more than just a mental burden. It has real biological effects that may increase cancer risk over time. By understanding how stress affects your body and taking steps to manage it, you can protect your overall health. Always consult your physician for personalized advice. If you found this video helpful, consider sharing it and subscribing for more evidence-based health content.